From the historical Lawrenceville School, my name is Kingsley Dew, and this is L10 News. Today, we're honored to welcome a truly remarkable guest, Dr. Roger Glass, class of 1963, and this year's recipient of the Aldo Leopold Award, Lawrenceville's highest alumni honor. Dr. Glass is a globally respected physician scientist whose work has transformed the field of public health. From leading vaccine research on rotavirus to directing international health efforts at the NIH and CDC, his career has been dedicated to saving lives and advancing global health equity. It is a privilege to have him back on campus. And without further ado, let's dive into the conversation.
Hi everyone, my name is Ari, and today I'm joined by Dr. Roger Glass, class of 1963. He's the recipient of the Lawrenceville Medal, which commends him for his life works in global health. Could you tell us a little bit more about your inspiring career?
You know, I came from a high school where I was really good in math and science, but I never worked. My parents were wondering why I was fiddling after school and not doing much. And they finally decided to came down, and I was interviewed and I was put on a waiting list. And just after Christmas vacation of my junior year, I got a call. There was a place at Lawrenceville and I should come down immediately if I wanted it. And I entered into this unique environment of excellence in teaching, and that got me really deep into science and good academics and working hard. I went on to college and medical school, but in medical school I traveled a lot whenever I could. My wife and we said, let's do something totally different, totally crazy. And so we decided to go to Bangladesh to do a cholera vaccine trial. And I did that never having seen a case of cholera or done a clinical trial. That experience was the greatest experience in health and learning. We learned so much about poverty, we learned about health. I also learned about rotavirus, which was a brand new virus. It turned out to be more important than cholera in the hospital. We were in a hospital in a laboratory that had over 100,000 patients a year. 30% of these had rotavirus. So that got me to think that maybe this would be a good target for control with vaccines. And that started my career. And from there, I finished my studies of cholera. And there is a cholera vaccine that came from work. I went to Gothenburg to do a PhD with my advisor on cholera. I went to NIH to learn about virology. And I went back to CDC to start a group. And that group has worked on rotaviruses and is still working on rotavirus. The challenges have been to get this out to the world. When rotavirus vaccines first came out and were licensed in the US, they were $200 a child. And having worked in Bangladesh, there's no way you could implement a program giving vaccines to children in Bangladesh for $200 a child. And so one of the things I ended up working on was to collaborate with a researcher in India to make a vaccine in India with an Indian strain, an Indian company, Indian funding, and Indian research. And we did that together with CDC, NIH, and the Gates Foundation and the government of India. And the issue was when we got to the clinical trial, it was going to be $40 million. It would bankrupt the company if the vaccine failed. So with the Gates Foundation and the government of India, they said, we will fund this. We will take the $40 million risk. If it fails, you haven't lost anything. But if it's successful, would you give us this vaccine for $1 a dose? And the owner of the company said yes. And he's produced more than 500 million doses that have gone out in India and in parts of Africa. So I went from not knowing what to do to being totally captivated by otherwise healthy children who just didn't have treatment. Why should children be dying of diseases that are easily treatable or vaccine preventable diseases in the world? It really is an issue of justice. The opposite of poverty is not wealth. The opposite of poverty is justice. Much of the benefit of research came from working with partners in the developing world. And I think that's been dissipated in this past 100 days by what's happened to USAID, PEPFAR, NIH funding, and CDC funding. So I'm very concerned about young scientists now going into science to continue this in the absence of a clear path forward. We have incredible new tools for discovery now that we haven't had before. The speed and the advance of science is accelerating. We have genetics, we have new screening devices. When my kids got vaccinated, there were only 7 vaccines available, the common childhood vaccines. Today there are over 30, and so we've really gone so much further. So there are lots of opportunities. Carpe diem, seize the day. You have such wonderful teachers, you have such wonderful opportunities, the facilities are beautiful. This could well be better than any college you go to.
And that's it for this week's episode. As always, if you have a story to share, let us know or stop by our office in the basement of Pop Hall. Be sure to subscribe to our YouTube channel to never miss an episode. And from all of us here at L10, thank you so much for watching.